Facebook world and everybody else out there. We're coming at you tonight. It's tonight for me, but we're coming at you. The Kokomo team. I've got Daniel Lee, Sa, and myself, Kara. We're all joining here for our weekly fireside chat. And again, tonight's discussion is going to kind of be a continuation, if you will, of what we've been talking about recently in terms of the vaccination management. But um, we'd like to talk about it from a more focused angle. For us, let's talk about it as an industry specific thing. So recently, most of you probably watched the Super Bowl or knew that it had happened on Sunday night, and as a result of that, there were very few spectators. Naturally, a lot of cardboard, very few spectators. So Sai, talk to me a little bit about, what would those individuals experience? The people that were able to go and attend and watch, what was their overall experience, and how does it segue into what we're talking about tonight in terms of vaccination management?
Sure. Well, I mean, I think first off, kudos to the NFL and the folks over at the Ronald Jones Stadium for giving out 7,500 Super Bowl tickets to healthcare workers who had been vaccinated already. So there were about probably 20,000 people, a little over 20,000 people allowed to go to the stadium. And the way they were seated was spaced out very well. So at a minimum, everybody was social distance where they sat, and everybody still had to wear a mask. And so in this early stage, it was too soon for any particular event or a venue to be able to require anything other than something like just a simple screener and making sure people were socially distanced. And it's interesting to see how event venues are going to approach the next phase, because certainly football can't survive by only allowing 20,000 people in a stadium that can fit over 60,000. That's just not going to cut it. And I know if those of you who were following football all season, the Buffalo Bills had a different approach for their Bills Mafia. I think they were only able to get people in attendance the last 2 games of the season. And what they required everyone to do was to go get tested at their stadium that Wednesday. And then they would receive results by Friday or Saturday, letting them know if they could in fact go and attend the game. Now that's a very arduous process.
Did they have to pay for that?
Yes, and yeah, the ticket holders, the people who wanted to go to the game, had to pay for that test. I believe it was like $80 to pay for that rapid test. They had to drive out to the stadium, get tested, and then within 48 hours they would be notified if they were cleared to go to the game.
Bummer.
So everybody is doing a different type of screening, and I think one of the important things we need to talk about is, we already talked about last week about general businesses and corporations looking at vaccine mandates and management programs for their workforce, which is fine, because the work office alone, you want people to be safe, and it's up to every company how they want to manage and enforce it. But I think the more concerning aspect is are all the businesses that are like the Super Bowl, where they survive based on customers coming, right? The retail businesses, the event space. How are they going to do that without some type of mechanism put in place to ensure that people are safe? Now, let's take football, for example. The state of Florida, Governor DeSantis has already made it clear he's not putting any type of restrictions on how businesses can choose to operate as far as screening and occupancy rate. Like if they want to occupy at 100% capacity, they technically can. Governor DeSantis has already said where the state of Florida is not going to enforce any specific occupancy mandate. So I've been in Florida several times now. So the decision, certainly for the Super Bowl, that's coming from both ownership and the NFL, the combination of Players Association, corporate headquarters, and probably ownership at the NFL. And I see that in many other businesses throughout the state of Florida. Like Disney is still only operating at, I think, 30 or 40% capacity. And a number of restaurants that I went to still require masks, aren't serving at all tables. They're spacing people out. And I think that's not necessarily because there's a specific mandate put in place, but in terms of the event and retail space, it's the perception of, is it safe to go out yet? Do I feel comfortable? And if the venue is not presenting themselves in a way where where that sentiment is being shown, or that level of care and proactiveness is being shown, people are afraid to go out. And that's the big concern right now, right? We already know retail stores and shops are already at a downward spiral prior to COVID, and COVID only expedited online shopping and the convenience of doing a lot of the retail stuff from home. So as we get out of COVID, how do we improve the experience so that customers feel comfortable to go back out? I think the restaurant industry is a little okay in terms of people will always want to go hang out with friends and eat, but where they choose to go, how the restaurant spaces out their tables, things like that, how they feel about staff, that's all going to change. This is all a brand new and blank slate for us moving forward. And part of the first step of maybe getting a sense of normalcy is the vaccine, right? I think at least in terms of the restaurant, if I'm going to go eat at a restaurant, I would feel more comfortable if I know the staff is vaccinated because they're touching my food, touching the silverware, touching the plates and things like that. And so restaurant owners have to think about that now.
Mm-hmm.
That's a big concern. Like, do I require my staff to get vaccinated? Not because, regardless of how you feel politically about the vaccine, does that mean I get more business because I can at least tell my customers my staff is safe, we're all vaccinated, or they get tested daily, or whatever the case may be. But to the point where, one, as a business owner, I can fill up my restaurant to as close to 100% capacity as possible. And then number two, advertise that, instead of going to, that place in town, my place is clean and safe because that's what we mandate for our staff.
No, I agree. And, from a woman's perspective, I'm thinking about like when I get my nails done, when I get my hair done, like you have people touching you, and it's just kind of like in the back of your mind, you're thinking about whether or not this person is carrying the virus, and you're doing all that you can in terms of precautions, like wearing a mask. But now you're hearing stories about two masks are better than one. And I'm like, I'm not going to wear two masks. I mean, let's be real. I'm lucky if I can find the one that I need to wear when I go places. But you're absolutely right. So I guess what I'd like to understand is, and maybe Daniel can answer this because it's more of like a technical thing, but if you're someone like the NFL, or if you are, any one of these, for me, it's the Detroit is my closest, so Ford Field, right?
Right.
Ford Field.
The
So
Lions.
if
Yeah.
if I want to go to an event at Ford Field, how are these organizations going to deal with individuals who have opted to receive the vaccine? How are they going to manage and oversee the influx of the individuals that want to come to an event, but the mandate is that you provide vaccination, like we talked about last week. Cruise ships, if you want to go on a cruise, you're going to have to get vaccinated. There's no ifs, ands, or buts about it. And slowly but surely, I think a lot of these areas that are seeing a mass amount of people coming together collectively, they're going to have a similar expectation. So what's the answer for them?
Well, I mean, we are going through phases, as Sa mentioned that. I mean, technically speaking, I mean, whatever we are gonna do can be done. I mean, it's all data points. Whether we collect, how we collect, and once we collect, how we display or how we bet or process the data is we can do. I mean, these type of things are not technically challenged. It's mostly adoption, right? And also
Mhm.
the whole society, what is okay at this point. So given that, I mean, I think this is one thing Sa brought up last time, that maybe we will do something similar to pre-check. I mean, it becomes kind of obvious, but if you are vaccinated, I mean, maybe there's a lot of pushback around mandating. So maybe not, instead of mandating, maybe if you get vaccinated, just like in Disney World, there's a fast track, right? You can
Mm, mm.
you don't have to line up for temperature scan, for example, something like that. So that I think our society, just like how we went through 9/11, after that, TSA, all those things, there was a lot of pushback but eventually, right now, I mean, after 20 years, I mean, nobody says anything about going through metal detector and all this,
True.
scanner, right? So we will definitely go through phases. And then in terms of providing, making that a little bit easier to swallow technically, providing easy way to handle this data and disseminate the data and use the data. I mean, Kokomo has been doing this for now over 11, about 10, 11, 11th month right now. So
Mhm.
that technology is there. There are some of the, forerunners like us providing various easy tools for an organizations or individuals to utilize, whether where how much it's adopted and okayed by people and accepted by society, it's gonna take time.
That's actually, so the fact that you brought up like the fast track lane using the Disney example.
That's a SaaS idea, by the way.
Oh, is it?
Analogy.
Okay,
Yeah, SaaS
okay.
analogy. Yep.
So
Don't blame me.
let's elaborate a little bit on that. Like, do you think in the realm of possibilities that you would have the folks that aren't comfortable taking the vaccine, but maybe are still required to have, a test, kind of like what they did with in the NFL.
Yeah, with the Buffalo
Um,
Bills. Yeah.
so it's almost like having like two separate lanes. You got the folks who've already been vaccinated, they can show proof of that vaccine. And then you've got the other folks who are not comfortable. I mean, is that a reality? Do you think is that like the first phase
I,
before people are confident?
I certainly agree that's going to be the first phase, because I don't think it's realistic to require everyone to take the vaccine. I
Sure,
mean, political beliefs, health beliefs, just even access to the vaccine, that's not even
sure.
widely available yet.
Mhm.
So certainly at a minimum, we'll see something very similar to what they have at the airports, the TSA pre-check,
Right.
the lines for the people who've been pre-screened, so that if you've been vaccinated, you have an easier access to get in and out of certain locations, especially event space where, you're processing thousands of people and they're going to be contained for a period of time.
Hmm.
I know that there's been discussions about venues like football stadiums and concert halls where there's, instead of a VIP section, there's the vaccinated section where all the guests there are vaccinated. So there's no social distancing really set up, and it's real easy to walk up. You don't have to wear a mask, things like that, because let's face it, the reality in this country is we're trying to get to a place where obviously COVID is gone. And
Right.
the most visible demonstration of that is eliminating the mask. That's something that's really a problem in this country as far as adopting that as a normal staple of life.
Right.
And so every time you still see that mask on someone, you're reminded of COVID, the pandemic, that not everything is safe, and that the person there might not be safe. I mean, it's the same feeling you had when you traveled the world and there's someone across from you wearing a mask and they're coughing and you're just like, ugh, you know? So I think that's really what we're trying to achieve just in the retail world, in the event space, is get to a period where we don't have to wear those masks anymore. And the only way to get there is where the virus is gone. And that's either through, herd immunity, everybody being
Yeah.
vaccinated, or whatever the case
Phases,
may be,
phases. Yeah.
right? And so it's taking time to get there. And if it's going to take time, businesses, I know, aren't going to wait until we get to that day where it's 100% gone. So the only way in order to operate is to figure out a way to appease the consumer base, for those who want the peace of mind and comfort knowing, hey, I'm vaccinated. Can I be sitting around other people who are like me so I don't have to wear this mask all the time? Versus everybody else who doesn't want to be vaccinated, doesn't have time, and they have to go through a more stringent screening process so that other people know that they're safe.
It is an interesting, the whole conversation is really interesting because I know people in the professional world that are a-okay with your decision to get vaccinated, but I don't want to get vaccinated. And
Right.
then there's the people who are, and then they'll take it a step further. They're like, I don't want to get vaccinated, but I would feel so much more comfortable if you were vaccinated. You're like, wait, what?
Right. It's just people just want to know that the other person isn't sick. And it's not an issue.
Yeah.
It's not even an issue of death. I think the real telling sign is when the vaccination protocol reaches the demographic of the 25 to 45-year-old group.
Yeah.
Because while that group is least likely to die from COVID-19, still nobody wants to be sick for a whole week. No one wants to lose their sense of taste and smell, or have to stay in bed and be stuck with a fever, or have trouble breathing. I mean, none of those symptoms are fun, because you lose time from work, you lose time hanging out and doing other parts of life. Nobody wants to get sick. And so regardless of how they feel about the severity of COVID-19, people at a minimum don't want to get sick and don't want to be around other people who are sick. It's just, that's normal and that's natural. The question is, what's the process to get there? And while we have a number of options, the problem is businesses have to figure out which option is best so that they can return to business, right? And get
Right.
customers and have people come back. Will people go shopping if they think all the employees handling the merchandise and serving them stuff could potentially be sick? Right. If I have two stores, if I have two restaurants side by side, and one where I know all the servers and the kitchen staff is vaccinated, and the other ones who isn't, right? And let's just say I don't believe in vaccinations. I think for whatever reason, I'm not a fan of it. I don't want to get vaccinated. I probably would still be more comfortable going to the restaurant that has
Yes.
vaccinated employees, because I'm not going to catch whatever they got vaccinated from if I don't believe in that, versus the other restaurant where I don't know what they're doing. I don't know what's going on, in the
Right.
kitchen staff and all
They
that
look at
stuff.
my hamburger. What are they doing?
Or and it's not, maybe it's not just the staff, it's other customers who sat at the table before me, and the staff person. I mean, it's a lot of, at least with the staff member being vaccinated, it stops one aspect of transmission that could take place. And so I know a lot of restaurants are looking at that right now. They're trying to figure it out. There's a lot of conferences where restaurant ownership groups are sharing these ideas and trying to figure out what is that balance, and maybe it's not at a minimum, maybe it's requiring it for staff, but not for customers,
Right.
or creating different sections, like vaccinated customers can eat indoors and non-vaccinated customers can eat outdoors.
But then don't you think that's going to cause like a whole discrimination argument?
Yeah, no, it certainly is. But we already
It's-
have that type of level of sectioning out with, like, say, like, if you buy concert tickets and the different level that you pay, or the different age group.
Oh, okay. I see what you're saying.
So
Yeah.
it's a temporary. I certainly think in the workplace you can't do that because of Title VII that we talked about last week.
Yeah.
And the EEOC, the Equality Employment Commission, wants to make sure that we're not discriminating employees based on vaccination unless you feel that an employee's lack of being vaccinated is a threat to the work. And that's potentially where, especially in workplaces that deal with a customer-facing environment, that's where that concern may be. And even if it's not required, again, if we allow freedom of choice from the retail customer base, who are they going to choose? Are they going to choose the business that has their employees that have a clean bill of health, versus the other one where I don't know, I have to take a guess?
Yeah, I think that's gonna be the de facto first step. Natural selection in a sense. There are two options. One has, in California, every restaurant has that ABC grade, like sticker out there, right? So if I have a same taco place, one is A, one is a C, which one would I go? Maybe probably A, right? Just like that, I guess having something like that as incentives of consumer, and then consumer naturally going there and more business there, which will naturally drive the desire for other businesses, other organizations to adopt vaccination as a
I think the other thing too is like, and let's make it very clear, like Kokomo is offering a vaccination management module that is part of one of our existing products. It's kind of its own little feature, and it's brand new. We're enhancing it weekly because we understand that this thing is evolving. But our stance is pro-vaccine. We are all about making sure everybody that is willing and able and it's available to them can get the vaccine because much like many other organizations, we just want to see things return to as close to normal as we can possibly get it. So, I mean, I don't know if you guys have any specific thoughts around, what that's going to look like in the future in terms of the return to norm, but we've kind of had that conversation. We've touched on some of the things that we are anticipating it to happen in terms of at least like events, concerts, sports, things like that. So what do you see? What do you see after vaccination management, in terms of the consumer to kind of keep the momentum? Do you foresee any other like roadblocks? Because I'm hearing things on the news about people who got the vaccine, both the first and second dose, who are getting, who are coming down with positive COVID test results. Like they get the virus again. So, what are your thoughts on that? Like, what do you say to somebody who's been vaccinated properly and is getting a positive test result? What's it going to look like for the employer then?
Well, first off, coming from the healthcare background that I have and all the research I've done on the vaccine in of itself doesn't prevent you from getting COVID. It just reduces the percentage significantly.
Just like
So,
the flu shots.
so that's
Yes.
one. Number two, if you have the vaccine, you're also more likely not to suffer from COVID-19 in any severe kind of fashion. So those are the two benefits of that. And so the whole point of the vaccine is for it to really work, we need the majority of the population on the vaccine, which gives the virus less and less options to attach to infect somebody. That's how we get to this herd immunity, so to speak. So that's why the CDC is still recommending at this time, if you have the vaccine, to still mask up and social distance, because the amount of people who do not have the vaccine dwarfs the amount of people who do have the vaccine. So it's going to take some time. And I understand that there are people that are concerned and don't want to be, quote unquote, the guinea pigs. And then that's fine. You have to make the right decisions that's best for yourself. But over time, this is going to help. Over time, as more and more people get vaccinated, as more data is provided, as you see more and more people seem to not have any of the side effects that conspiracy theorists are talking about and turning into zombies, so to speak, more and more people will feel confident about taking the vaccine. And that's just going to help, especially once you have family and friends who take the vaccine. And after some period of time, they seem normal and fine, and they're able to go do stuff that you still can't do, or have the convenience and peace of mind of going out and being able to go see shows or travel, and the convenience of being able to flash their digital vaccine card. That's going to make a significant difference, because what I do know is people don't want to stay holed up at home. They don't
Right.
want to do that. And at some point, we've tried doing nothing for 10 months. We didn't have the vaccine for the first 10 months of this pandemic. That didn't work out so well. And we thought it was getting better, and it actually got worse. And the worst period we went through was just these past 3 months. Highest infection rate, highest death rate. I mean, clearly something had to be done. And so you can't just expect to sit back at home and expect nothing to happen. That's
Right.
I wanted to just give. I mean, I'm engineer by trade, but I'm not a healthcare person. But just to give a perspective, is that, maybe 50 years later or 100, 200 years later, I just googled the smallpox. When it was the smallpox vaccine was first created, it was about 200 years ago. Imagine that. I mean, do we argue that smallpox vaccine is not it's dangerous or it's all that? We don't argue that. When you send your kids, everybody your kids gotta have this vaccine to be able to go to public school, right?
Mm-hmm.
It is just common sense at this point. So just like that, I think this COVID or flu, whatever. I think it's just becoming a norm of in order to do whatever the great, who knows, the we will go through the phases, and we will start with kind of an incentive incentive based to maybe later mandate it, just like a smallpox is, vaccine is, now, 200 years later. Um, but eventually it is same analogy. I mean, it is to prevent, to help us, society be safer place. Not, not believing it and whatnot is definitely personal choice, but it's coming down.
Yeah, it's the reality.
Well, I mean, yeah, I mean, I think we just saw an article. We talked about this the other day. Kroger was incentivizing their employees
Yeah.
And
to
one
get
of our
vaccinated with a
clients,
what a
one
hundred
of
Yeah.
our
dollar gift
clients
card or
are
something like
also,
that.
yep, giving gift
Yeah.
So
cards, right, for
yeah,
vaccine. Yep.
so
They're
that, I
doing
mean,
anything and everything they can to get people to get on board because they see the need. But it is interesting. I guess I didn't look at it from the perspective that you're not freed from getting COVID, you're just less susceptible. And then you've got those people who are like, I've never taken a flu shot ever, like I'm in my 60s, I've never had a flu shot. Well, maybe you didn't need it because perhaps you are just one of those lucky people that don't have to worry about being as susceptible as the next person. And that's the mindset that people don't understand. It's like, this isn't about you not ever getting COVID because you're vaccinated. This is about prevention. It's a measure in which you can take to help prevent getting it, but it's not a fail safe. So,
Yes, it's a mitigation of risk.
right,
Yeah.
exactly.
I mean, maybe that person was a type of person who washes hand all the time, like me. Then I never had to get I mean, while all my family members got flu on, every season, I'm the only one who never got flu. Bec- But that's, washing hand is one of the factors. It's a risk, that I'm lowering the risk does not mean that I'm immune to, or I'm kind of, safe. I would never get flu. I just got, less, mathematically less chance of getting it. But
Mhm.
there's a chance of getting it. Once you get it, there's no middle way. I mean, little way of getting it. You get it, right?
Right.
So the vaccine is all about, just in case those cases that you get that, virus in your body, and then, your body is trained to fight it, better. That's the whole concept of vaccination. I mean, again, I'm not health, all that, but it's just knowing how flu shot works, knowing other vaccine works. I mean,
Yeah, no, I understand. So I think in terms of like, we've touched on the concept of the vaccine and what it might mean to different people and the fears that go along with it. And we haven't even probably touched on all of them.
no.
So you anti-vaxxers out there, we understand, we do. But the premise behind this conversation essentially is to just talk about the fact that um, there's certainly something coming down the road. We don't know what it's going to look like. There's going to be some companies that adopt it and others that don't. And your only option, if they do adopt it and it becomes a mandate, is to not work for that company, because what are you going to do? I mean, you can argue that it's a religious belief. You can argue it from a health perspective. There's obviously lots of ways that you can present yourself in terms of where you work if it were mandated. But the overall concept here, guys, is, you know, we're providing a tool. That's what Kokomo does. We provide tools to companies, organizations, churches, restaurants, you name it. We help take care of it. And this tool is specifically just providing you with information as an administrator, as somebody in HR, as a manager, supervisor over a subset of employees. We're just giving you the information you need so that you can carry out and execute your day as though COVID had really never happened. Because we're trying to keep people in the workplace, avoid people from getting sick and having to quarantine, all of the various things that have come that we weren't expecting to deal with that have come with this pandemic. I'm trying to mitigate that as much as possible. So, I mean, It's kind of the crux of it, right, guys?
Yeah, I mean, we are enablers. We are the toolbox. We are making handling this pandemic as well as ongoing health and safety incidents cases handle a little bit easier for both organization as well as individuals to be able to bearable, make it a little bit more bearable. And technology is around to make things easier, and it's just we are making it more readily available instead of spending fortune to have something. The technology is now became much easier to I mean, it's easier to actually build something for you nowadays that uh, especially around public safety and health. It's one of the industries kind of lagging in terms of adopting kind of hot and cool technology. So Kokomo, I mean, our mission and what we feel good about is that bridging the gap of the technology being available to the pain that you potentially as an employer, organization, or as an individual you are facing today, bridging the gap so that you can make it a little bit more bearable.
That's a good,
Absolutely.
I think that's a good ending.
Absolutely.
All right, guys. So I think that kind of concludes this evening's fireside chat. We love hearing from you. Even the folks that want to hate, it's okay. We like hearing you out too. So continue to leave those comments below the video that you're seeing, and reach out to us with questions or concerns that you have. We'd love to hear from you. So I think next week's fireside chat might be a little bit different. We're going to be working on getting some guest speakers actually at the end of February, which is going to be pretty exciting because then you're going to get to see and hear from some folks that are in the field, boots on the ground, so to speak. And we look forward to that opportunity. So with that, I think we're ready to sign off, right, guys?
Yeah. You guys have a good one. We'll see
All
you
right.
next week.
Until next week.
Okay.
Bye.